Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you another in our series of interviews. In this case, it's with people that are really pushing forward the model of care. And so I'm excited to learn about this mix of people and technology, which I think is so important as we continue to evolve healthcare. And our special guests today are Angie Stevens. She's founder of Health Logx, and Julie Mann, chief commercial officer at Carium. Welcome, Angie. Welcome, Julie.
Hi, thanks for having me.
Hi, thanks for having us.
Yeah, so excited to dive into the topic today. But before we start, Julie, you want to start us off and tell us a little bit about yourself and Carium?
Sure, thanks, John. So my name is Julie Mann, and I currently am the Chief Commercial Officer here at Carium, which means I lead the front end of our business. So I get to oversee customer success, account management, sales and marketing, and business development. This is actually my 20th year in healthcare IT, which seems crazy.
You started when she was 3. Okay.
I know, exactly. I would say the theme of my career has always been to work for innovative companies. And so back 20 years ago, I used to do implementations where I would take people from a paper appointment scheduling book to digitize it, right? And that was innovative at the time, right? So it's really cool to fast forward to today to see that now we're delivering care from home. And so that's what I'm excited to talk more about today.
Awesome. Glad to have you here. And Angie, will you introduce yourself and Health Logic?
Sure, thank you. So my name's Angie Stevens. I am the founder of Health Logx, a turnkey remote patient monitoring and chronic care management service. I'm a nurse and a diabetes educator and certified health coach. Started out nursing in a hospital unit, cardiovascular unit, and really saw the trend of patients coming in with the same type of unhealthy lifestyle habits that brought them there, needing interventions. And I felt like I just really want to get to these patients before they need these interventions. So I switched to primary care, which I loved, but realized in the, seeing patients back to back, you still got to address the health maintenance and lifestyle habits, but you still didn't have very much time at all. And, health was happening not just in the office, but at home. So I knew still there had to be a better way. And thankfully, I got the opportunity to work with remote patient monitoring in 2013 and really opened my eyes. This was it. This was a game changer for healthcare and for chronic care management. So I've been using it since.
That's awesome. And I love that you have a nursing background and perspective on this. And, our audience understands chronic care management is expensive. I think we all know the stats behind that, right? And we all know that the 15-minute, if we're lucky, visit with the doctor doesn't do a good job of managing that, right? So I think, as a baseline, we all understand this, but what do you think, Angie, is really the key to effectively managing chronic disease?
I think you need time with patients, and it's not, you just don't have that in the office in the current healthcare models. So having this opportunity, being able to remotely work with patients for any clinics, I think being able to add on a remote patient monitoring, having a clinician that can work with patients outside of the office, that can monitor their trends, identify and address abnormal trends in real time. I think that's key. It's a game changer. It really is.
And how do you, so I think it's interesting that you're a nurse doing this. Like, who is the right person to be doing this care at home, if you will, right? And this remote patient monitoring, and what's the involvement between a doctor, a nurse, a care manager? How do you see that playing out?
So I like the model of having a nurse as a clinician or a diabetes educator certified diabetes educator if they're working with diabetes. I think you need to have, especially with the disease state, it depends on the disease, but we've got patients with heart failure. It's a great opportunity to be able to identify trends in real time and to address those and keep patients out of the hospital. But you need a clinician, working with these patients and looking for the identifiers and their metrics. And having that communication with the doctor, being able to speak with the doctor, collaborate with the patient, the caregiver, and the physician. And sometimes with specialists, it takes a village, to manage these. Sometimes they have comorbidities and you're dealing with multiple doctors. So having that clinician who's basically takes on the role of the care navigator is key, I think.
Well, and to me, doctors haven't been trained to do that, and they're expensive. I mean, more expensive. So I think it's interesting. Julie, anything you'd add to what she said about effectively managing chronic disease?
Yeah, I think, John, like what comes to mind for me is like, how can you just do it, better, faster, cheaper, right? And how can you do that with limited resources? And like you said, some of those resources are really expensive. And that's really where technology kind of comes in, right? And what we're starting to see is purpose-built technology to remotely monitor patients from the comfort of their home. And so being able to have the tech kind of complement like the great work that a skilled clinician like Angie can do is really helpful, because what it allows her to do is really scale her reach and take care of many more people than she would be able to do otherwise.
So what should the technology be doing, and what should Angie be doing? How are you seeing that? I mean, obviously Carium has a platform that Angie uses to be able to do this, but where do you see the technology doing stuff, and where do you see, no, Angie needs to step in and do this?
Yeah, there's not necessarily a one size fits all for everybody. I think it really depends on the organization and their patient population for sure. But what we typically do at Carium is we just like to kind of map out the different work streams. Typically when you're designing for technology in healthcare, it's very single threaded, right? Meaning that people are ultra focused on maybe the care team's experience, and like the patient is an afterthought, And then when they put the tech in the hands of the patient, right? Patients are like, I'm not going to use this. And or the flip side of it, is where you're just innovating with the patient in mind. And then the doctor or the clinician gets it and it's not really usable because it's too cumbersome. So for us, we try to be very focused on mapping out what the patient's journey should be in an ideal state. And then also then mapping it with what the care team's experience should be in that state. And then it becomes very obvious where the tech can intervene to insert automation when necessary. So for example, like with the work that Angie's doing, when she's managing a panel of patients virtually, they're taking their readings, every day from their home. Those readings then are kind of feeding in through Carium, and then she can view what's going on at a dashboard level. But she doesn't have to stay so close to it to like micromanage every data point that's coming in. Instead, she can get alerted when there's an exception that requires her attention. So if some reading comes back and she's designated that reading is abnormally high for that patient, that can give her a little tap like, hey, Angie, you should be aware of this. And then Angie can make the judgment on what needs to happen. And so I think it's just having kind of that thought process of being very conscious that you have to design for the patient, you have to design for the care team, and then being able to have the tech kind of augment and complement and scale the clinician's reach.
That's a good way to look at it. And I've heard it a lot, right? I mean, doctors always say, great, we're going to collect all this analytics, but what do I do with it? Right? Like, how do I make it actionable is the interesting discussion. Is that what you were looking for, Angie, when you started working with Carium, was a way to collect the data and make it actionable? Or were there other benefits that you really were looking for from your technology partner?
Yeah, absolutely. That's definitely a key component that I was looking for, but also it needs to be user friendly. The patient population that I'm typically working with right now is Medicare age.
Yeah.
And sometimes they're not the most tech savvy. However, in today's age of Facebook, smartphones, they're definitely much more tech savvy than they used to be. But so that's one thing. And I hear patients say this, oh, well, this is so easy, so having it be user friendly for patients is so important. But they have such a comprehensive build, robust platform that offers a library, so I can send resources to patients, relevant resources based on things we've talked about that day, whether it be sodium, how to keep your sodium levels down, how much sodium is in foods. They have a nutrition tracker. That's key for patients who are looking to lose weight, which can, help with blood sugar, blood pressure, most conditions. So that is huge. They just had so many pluses on their platform that was just, it made it the perfect platform for me to use.
So let's hear some examples of any stories you could share of, patients you've worked with where this type of chronic disease management, this, proactive outreach really, I think is, obviously targeted, where has it been effective? What's been the impact on patients?
Sure. So I'll give you a couple examples. I have one patient who has an irregular heart rhythm that she goes in and out of. She also had a diagnosis of hypertension, overweight, and insulin resistant. So was just on the border of diabetes. So we started talking around, I believe, November of last year. And she has lost, just in coaching and her monitoring her blood pressure, and as working on opportunities identified with diet, activity. She's increased her activity. She purchased a Fitbit, and now that's populating into the platform. So, and she likes having that accountability. She knows that her nurse, Angie, and her physician also, her cardiologist, can see her blood pressures, her heart rates, her steps, her activity. And we can also message each other, and it's transparent for her physician and all of us to see. So she has lost, I believe, over 12 pounds. She's lost 3 inches in her waist circumference, which reduces her cardiovascular and metabolic risk. Her A1C, the diabetes, the test that we use to show range of diabetes or prediabetes, has come from diabetes to prediabetes and is getting very low to almost hit normal. And she just feels better. She has like I said, she also has a regular heart rhythm. So whenever she goes into that, she goes into a high rate, it makes her really nervous. So she reaches out to me through the messaging platform. And she has mentioned that this just makes me feel not isolated when I go into this heart rhythm. And we've kept her out of the hospital just because I think without having that, she would have immediately gone to the hospital. But having this and being able to talk with a clinician, and we can kind of gauge whether she does need to go or not. And that has kept her, has given her peace of mind, I would say.
Yeah. There's something so powerful about someone who just cares to know about your health, right? I mean, when you're talking about, the fact that she recorded all of this, I thought of my grandparents who were obviously pre-technology, and they would keep all these journals from my grandfather who had diabetes for 30 years. And she's like, I don't know why we keep them. I don't think they even look at them. It's like, but just that simple fact that someone's going to look at it, even if it's an AI bot that looks at it and accelerates, I think changes the dynamic in an interesting way. And then it's just powerful to have someone that you can reach out to. That's fascinating.
Right.
Julie,
Yeah, and I think
I was going to say, I think it's really interesting that what Angie was just describing are things that we hear from our patient users, like across our different partners, right? Because it's exactly that. It's like, finally, they have that connection, that they didn't have. Like, finally, they're being held accountable, right? So instead of like just in clinic visits, right? It's in between those visits now. And that it's being data driven, right? Based on their data. So just like your grandparents that were keeping those paper journals, now it's all, digitized. And if the result is personalization, right? So when Angie now is going to go talk to her patients, like, she actually knows them. And when I say knows them, like she has a holistic image of what's going on with them. One of our other patient users just recently shared with our team at Carium that he equated Carium to being kind of like a guide in his recovery, you know, and he equated it to what to expect when you're expecting, you know, the book that women get when they're pregnant, right? But you can look at everything up in that, right? It's like, okay, this is going on. And then his care team, like Angie was telling you, would share learning content, you know, educational articles that were exactly relevant for him at that point in time based on what he was experiencing. And so when he gave that analogy, I laughed because I was like, it's so true. That's what people need. They want to know, like, specifically what should they be expecting and if it's normal or not normal, but then have their care team not just measuring them like on some random scale of like a pain scale between 1 and 10, which everybody is different and variable, but instead kind of looking at their different readings that they're capturing, combining that with what they're saying, and then being able to make a better treatment path. You know, I think that's what's really exciting about having this technology be in between the clinician and the patient.
Angie, do they ever abuse this? I know that's a fear that many provider organizations have. It's like, wait, if they have access, they're going to, you know, try to abuse the relationship and that channel of communication. Do you have that experience, or how do you see patients reacting?
No, I try to set expectations in the very beginning. It's part of my consent form in the beginning that they sign that this is Monday through Friday.
Gotcha.
You know, any messages after a certain time period will be addressed the next day. So my patients know that it may not be looked at on the weekend. So no, I haven't had that.
Yeah. I mean, it's interesting. So many people are afraid of this, and yet,
Right.
you know, the patients you actually want to engage, you can't get to engage because we realize that most of us don't care about our health. Like, I mean, it's a sad thing to say, right? But it's true. Like, I don't want to go and bother my doctor because it's not something fun to do, right?
Well, I hear that a lot from my patients. They will mention things to me and say, well, I didn't want to bother, you know, Dr. So-and-so with that.
Yeah.
And they're pretty, you know, valid comments that they should be asking, clinical symptoms that they're having or medication, you know, questions. But they don't want to bother their doctor. So I don't know if it's just us, our patient population who are more on the polite side and don't want to, you know, but I love that they have that connection to me and they feel comfortable. Well, I'll ask
Right.
Angie, and you know, and a lot of times I do end up queuing it up to the physician. So I hope in this, my goal is to reduce physician burden. All that data that you're talking about, I only bring them data that I feel like we need to address this, or here's their averages for the month, or I think, you know, they've lost weight and we need to come off of medication because their blood pressure is so much better now. They're starting to get lightheaded. So that's what I hope to, you know, to prevent. I don't want them to have to deal with that, all that data.
And it's interesting. Is the physician's reaction a good one? Like, oh, wow, I have all this data? Or is it, wait, Angie, are you taking my job? Like, how is the physician reaction, you know, when you're working with the patient?
I think that they like it. I mean, I don't want to speak for them, but they tell me they do. So I think that they also like that the patients have another resource and another, you know, clinician when they're at home, you know, in the comfort of their home, that is helping them with their health, meet their health goals, and identifying potential risk that they may have, and helping them identify opportunities that can help them lose weight and get off medications potentially.
That's great. Well, I think a lot of people love this idea. They love this model, but I think they also sit back and say, how are we going to pay for this? Right? Julie, what do you think on that regard? How do we pay for this in our current healthcare system?
Yeah, no, you're spot on with that. I think it's very rare that we are talking to somebody and they don't think it's a good idea, right? So their next
Yeah.
question is like, okay, how do we get started? And to get started, it's like, how do we find the funding for
Yeah,
this? So
exactly.
probably the most popular program that people use to get started with Carium is under CMS with the remote patient monitoring program. And it's really nice because there's simple CPT codes. There's pretty simple guidelines which allow you to kind of take care of people virtually. Carium automatically kind of tracks all the requirements for the program so that at the end of the calendar month, we have a report that you then give to your biller so that you can submit it to CMS and get reimbursed rather quickly. So the ROI speed to value is really there, so instead of having to wait for some other programs that maybe take a year, kind of crunch all your data, see if how you did from a quality cost perspective, and then, kind of give you some bonus or penalty, that's a nice way to kind of get started. On the other side of that, many people partner with Carium because there's significant cost savings. So they've understood, they've already converted into value-based care. So the way that they're treating patients is just different, right? They're focused on outcomes, they're focused on prevention, and they need to be able to do that at scale, at the population level. And so we partner with our customers to identify use cases that support that. And RPM, you can slice it up in a bunch of different ways, right? But
Absolutely.
many people can look at RPM, different RPM programs that can help with like readmission rates, right? So when you think about like post-surgical care, most post-surgical care programs release patients after surgery and give them kind of a protocol that they're supposed to be following and say, we'll follow up with you in 2 weeks. During that time, patients are kind of left on their own. They're really stressed, they're vulnerable, they're not feeling well. And so with Carium, we can really transform what that experience is like for that patient, by again, like remote patient monitoring devices, like send them home with a blood pressure cuff, send them home with a digital scale, have them have that connection through their mobile phone. So if they have questions to ask, they're one tap away from their care team. And so those programs play out really well. And so some of our customers have upwards of 40% reductions in hospital readmissions. So when you talk about how to fund it, there's kind of like the baby step way, I think, of going into remote patient monitoring with CMS, which is that great kind of quick return, or kind of that longer term play. It's like, let's prevent really bad things from happening and be able to kind of measure that impact.
Yeah. And is that how you approach it, Angie, is those remote patient monitoring codes? And I'd love to hear I hear a lot of people talking about those codes and say they're not quite enough, but it seems like you're making it work.
Yes, those are the codes that I'm using. I'm using the CMS RPM program. I do wish that other private payers though would jump on board, just because I have some patients who have diabetes and they already have complications, kidney complications, vision complications, and when I talk to them, I can tell that they haven't had the chronic care management, in their early diagnosis that
Right.
could have prevented this, or maybe they had it and they just failed to listen. And I know that this program works, and I see them using it and their outcomes improving. And I just feel like if I could get the patients when they're first diagnosed, or even, before, and prevent these complications.
I mean, it's beautiful to hear you talk like that. It's just fast. Yeah, I almost feel a Bible rally. I believe, but it does have. I mean, I'm sure you dealing with patients every day, you see the impact of it. And the question I've asked in this regard, though, is like, can we scale Angie, right? Like, can we scale this model of proactive, personalized care to everyone who needs it? And what does that really take? I mean, obviously, you already mentioned we need private payers to start reimbursing it, but does this model scale, or is this something that's just unique to where you're living in your patient population?
The model definitely scales. Yeah, I
Yeah,
think
go
the
ahead.
model definitely scales. It depends on what path you take, right, John? Like if it's like depending on your contracts that you have, I think there's different avenues that you can take. by what like CMS will do and pay for, what commercial plans will do and pay for, if you're a member of an ACO, if you're a member of a health system, if you're independent. But regardless of kind of where you kind of fall in those different paths, you can find a way. And we partner with people that kind of get there with a variety of different things, including grants. There's a ton of grants right now that are out there to really help kind of push this forward. A lot of it reminds me of, back when people were in paper charts and then they had to get to push the EMR, right? There was a lot of carrots and sticks kind of involved to get that going. And that's certainly the landscape of what we see today. I think what's most helpful is being able to highlight success stories of like who's doing it well and how are they doing it? Like, what is that playbook for success? And I think some of the misconceptions that people have, you've already kind of touched on, like with Angie, like who runs these RPM programs? Like what are the skills of that care team? And I think it's a misconception for many that are reluctant to start RPM is that it's going to be too burdensome on the doctor, right? And so we have not found it that way. And you heard Angie talk about like how her organization's structured. And that's what we see across our customer base is there's these new kind of users or new roles kind of emerging, like called health coaches, care advocates, which is so awesome because that's kind of what they are. Like you have your personalized health coach, right? That is kind of intervening when you need kind of that kudos or nudge or at least awareness of, your behaviors aren't as healthy as you thought. So I think coupling kind of that mindset of there's a recognition that we have to fund it, right? Because people are largely not going to do it if they can't fund it. And so identifying if your pathway is you're going to kind of either make money or save money, is a big thing. Then also now they're just the ease and accessibility of the tech. 10 years ago, like when Angie first started doing this, like she's a pioneer in this space. Yeah. The tech was not good, right? So it was harder, but they still believed in it and had great outcomes to prove. Fast forward to today, we have many of our customers that, are doing like deviceless RPM, right? Or like a bring your own kind of device, meaning something like an Apple Watch that people already have can work. And so if you think like the threshold to kind of get up and get started is so low, so a lot of those barriers are being removed that are going to allow it just to be more and more scalable.
Yeah. Angie, what would you add to that?
Yeah, absolutely. It's definitely a lot easier than when we started, and especially since, CMS is reimbursing since 2020, that definitely helps. But yeah, most of my patients that start have an Apple Watch already or a Fitbit. Almost, I would say 98% of them have a smartphone and have downloaded an app before. So it's definitely easier, and patients like it. Like I said, I hear them say, well, this is easy. And it's just downloading an app and then checking your blood pressure or blood sugar daily. And possibly they were going to be doing that anyway. Yeah, easy, and having the peace of mind that someone's watching their numbers and reaching out to them, and just having the information, having the library, the learning content that they can always refer back to, and the messaging platform. That's just, I think, has been huge for my patients.
I think it's beautiful that patients are going to be doing this already, but now it's just in a more connected fashion and connected to someone who could care for them. So I think that's a brilliant approach. And thanks so much to both of you. I appreciate you sharing these insights and perspectives. I think we all see that remote patient monitoring is the future, and this type of proactive care is the future. And how do we get there, I think, is the question everyone's asking. And how do we do it within this current healthcare system? So I think you guys both shed a fair bit of light on this. So thanks so much. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Julie. Thanks, Angie.
Thank you.